Right, grade 11s, carrying on with the same PowerPoint that I was busy with last time. In other words, the one that covers diseases of the lungs and the spirometer. But we're in fact going on to our third disease of the lungs, and this one is about lung cancer. So lung cancer is a type of cancer that begins in the lungs. Obviously, it can spread to other parts of the body if it has started in the lungs. And it's the leading cause of cancer deaths worldwide, not deaths, cancer deaths. People who smoke have the greatest risk of lung cancer. Though lung cancer can obviously also occur in people who have never smoked. The risk of lung cancer increases with length of time and the number of cigarettes smoked. And the chances of a smoker developing lung cancer can be significantly reduced if the person quits smoking, even after smoking for many years. Lung cancer typically doesn't cause signs and symptoms in its earliest stages. So one of the problems is that a person who has lung cancer might not even know in the early stages if they have it, and this would be the best time to treat it, which is a sad situation. So signs and symptoms of lung cancer typically occur when the disease is advanced, and they may include a new cough that doesn't go away, coughing up blood, even a very small quantity, shortness of breath, chest pain, hoarseness, losing weight without trying, bone pain, and having headaches. So doctors believe that smoking causes lung cancer by damaging the cells that line the lungs, and obviously, and I'm sure that you've learned this in previous grades, the cells that line the trachea and the bronchi and the bronchioles. Inhalation of cigarette smoke, which is full of cancer-causing substances, and the correct scientific term for anything that increases the chances of getting cancer is the word carcinogen. So the carcinogens in cigarette smoke result in changes in the lung tissue, and these begin almost immediately if a person begins to start smoking. So let's do a best case scenario and say that a person doesn't start at age 17, but say starts at age 25. Then even although they haven't been smoking for a long period of time, those changes start occurring. And at first, the body's actually able to repair the damage. But with each repeated exposure, normal cells that line the lungs are increasingly damaged. And over time, the damage causes cells to act abnormally, and eventually cancer may develop. The risk factors other than smoking are numerous, and some of these are an exposure to second-hand or even, in fact, third-hand smoke. So a non-smoker has an increased risk of lung cancer if exposed. It's not a good sentence, is it? I've got two increases. If exposed to second-hand smoke. And that would mean something like sitting at a restaurant table where the smoking section of the restaurant actually is not fully isolated, and so you at your table can smell smoke coming from the smoking section, or are inhaling smoke. So the poor waiters and waitresses who have to go into the smoking section are obviously consistently exposed to secondhand smoke. Third-hand smoke, although it's not mentioned on this slide, is things like some of the chemicals in cigarette smoke become embedded, like in a person's clothing, or in the curtains in a room, or in the carpet in a room. And those chemicals actually remain there for a very long period of time. So let's consider, say, a family that's just moved into a house where the previous people who lived there were smokers. And let's say the family that's just moved in has a little baby, and the baby's crawling on the carpet. Then that baby is being exposed to the chemicals from third-hand smoke. And that also increases the risk of that child developing lung cancer later on. Okay. Previous radiation therapy. So having undergone radiation therapy to the chest for a different kind of cancer may also increase the risk of developing lung cancer. Now, this is not this normal. Doesn't occur that frequently, but exposure to radon gas. So radon is produced by the natural breakdown of uranium in soil and in rock and in water. And that eventually becomes part of the air inhaled. And unsafe levels of radon can accumulate in any building, including homes. Exposure to a substance called asbestos and other carcinogens. So workplace exposure to asbestos and other substances known to cause cancer, such as arsenic, chromium, and nickel, can also increase the risk of developing lung cancer, and especially if exposure occurs in a person who's already a smoker. And then family history of lung cancer. So people with a parent or a sibling or a child with lung cancer also have an increased risk of the disease because there are genetic factors that predispose an individual to getting particular kinds of lung cancer, or particular kinds of cancer, sorry. Okay, so treatment of lung cancer. People can be treated with surgery, with chemotherapy, and with radiation therapy, as well as targeted therapy or a combination of these particular treatments. So let's have a look at smoking. Smoking causes at least 15 different types of cancer, including mouth, pharynx, nose, sinus, larynx, esophagus, liver, kidney, stomach, pancreas, stomach, kidneys, bowel, ovary, bladder, and cervix, as well as certain kinds of leukemia. Now, leukemia is specifically cancers of the blood. Okay. So the size of the circle indicates the number of individuals in the UK with the various kinds of cancer. And what you can see is lung cancer is the most prevalent of these kinds of cancer. Esophagus is quite high, bladder cancer is quite high. So there are many ways that the combination of harmful chemicals and tobacco smoke can cause damage in the body. Some of those chemicals have been found to damage DNA, which, remember, is the chemical which makes up the chromosomes. And an example of a chemical in cigarette smoke is benzopyrene, and that is found in cigarette smoke. And it causes damage specifically at a part of the DNA which normally protects the cells of the body from cancer. So you can remember this because next year, when you deal with the study of DNA, you actually have to know the names of certain carcinogens or mutagens. In other words, chemicals that actually cause a change in DNA structure. And this is a really good example of one. So if we asked you next year, name a mutagen that causes changes in the structure of DNA, it's not accurate to say cigarette smoke, because it's not every chemical in cigarette smoke that causes changes in DNA structure. But this is one particular example of one that does. Okay. So this just shows you an infographic. The fact that there are more than 5,000 different chemicals in cigarette smoke. They go into the bloodstream. They can affect the entire body. They don't just affect the breathing passages. And those chemicals change DNA, including key parts that normally protect against cancer. Other chemicals cause damage by then interfering with how cells naturally repair DNA damage. And this DNA damage can cause cancer in various cells. So this just shows you some of the harmful chemicals that are present in cigarette smoke. So there's nicotine. This doesn't cause cancer, but it reaches the brain, it increases heart rate, it raises blood pressure. Carbon monoxide and tar, but those are not actually the chemicals that cause cancer necessarily. So these are the chemicals that are found in some of the 5,000 chemicals that are found in cigarette smoke. And these are the equivalent things that they do. So nicotine, in fact, is actually a really, really effective pesticide. It's possible to take a packet of cigarettes and boil them in a pot of water. I know you guys think that that's horrific at this time of lockdown when nobody can get hold of cigarettes, so I wouldn't be able to do it at this time of the year, of 2020. And then that water can actually be used as a spray to spray onto plants that are infected with an insect pest, say aphids. And it's exceptionally effective. It actually kills them. How scary is that? People are inhaling it into their lungs. Now, this particular site has a video on the black lungs of a smoker. If you go to the site, scroll quite far down towards the bottom of the site, and you will see a video on the black lungs of a smoker. Okay. Emphysema. So emphysema is a chronic disease, and that means that it's not curable. Okay, it's ongoing, it can't be fixed, it doesn't get better, it can only get worse. And most commonly emphysema is caused by smoking. So what happens is the alveoli become damaged and they lose their elasticity. So remember that when you dealt with exhalation, you learned that the alveoli of the lungs have got elastin and collagen fibers in their walls, and they confer a certain property of elasticity. So when a person breathes out, those little fibers contract and they push the last parts of the air, except the residual volume, obviously, they push some of the air out of the alveoli. Now, with emphysema, those fibers lose their elasticity. And so the lungs are not emptied of the air from which the oxygen has been extracted. Now, I know that I've spoken about the fact that not all oxygen is extracted from the air. So if the air being breathed out is tested, there is always a certain quantity of oxygen in it. But because this is a continuous process with emphysema, the air that's held in the lungs is obviously less and less oxygenated. Okay, so in addition, the cigarette smoke causes the cilia in the breathing passages to actually break off. So this is not just that they become paralyzed, as they do initially when a person starts to smoke cigarettes, but they break off, and this exposes the epithelial cells to damage. Phagocytes, which remember are certain cells of the body's immune system, that are produced, and they secrete an enzyme that actually goes into the lungs and it digests the walls of the alveoli. It's a protease enzyme. It's one that digests proteins, and it results in emphysema. So what you can see then is, if you look at the diagram on the left-hand side and you look at the two drawings of actual lung tissue. So the bottom one shows normal alveoli. And remember, we've spoken about how important large surface area in relation to volume is in ensuring effective gaseous exchange. Now, in normal lung tissue, the alveoli, because there are millions of them, ensure that there's a large surface area in relation to the volume. But if you look at the drawing just above that, what you will see is, because the walls of the alveoli have become broken down, the surface area related to the volume. So the volume is exactly the same as it was originally. That hasn't changed. But the overall surface area for gaseous exchange, those walls of the alveoli, are no longer there. And so the gaseous exchange surface in this diagram is simply this part here, and then this part here, and that. So it's much, much smaller than this was. That means that not enough oxygen is going to be absorbed, not enough carbon dioxide is excreted. And so the person gets less and less oxygen going to their cells, and they become more and more unable to exert themselves because they can't do cellular respiration effectively. So in the news over the past few years is information about the effects of vaping or use of e-cigarettes. So I'm just going to use the term vaping. Okay. Let's have a look. E-cigarettes or vapes, although they touted as being less dangerous, in fact do produce a number of dangerous chemicals, including acetaldehyde, acrolein, and formaldehyde, which is formalin, which you know is incredibly dangerous. And these cause lung disease as well as cardiovascular or heart disease. And the safety and long-term health effects of using e-cigarettes or other vaping products still aren't well known. And that's because they haven't been around that long. And so just like when cigarettes were first released, everyone thought they were amazing. There were doctors that were saying to people, you should start smoking. You'll be far more relaxed. It'll cure your nervous condition. It'll be great. Doctors used to sit actually in their consultations with people. Doctors used to be smoking in front of their patients and encouraging their patients to smoke. That's because for many decades, nobody made the link between cigarette smoking and the increase in the incidence of lung cancer. And in fact, when people did start making the links, remember that the tobacco companies suppressed all the information that was coming out of the research because they didn't want to lose their income. So because e-cigarettes and other vaping products have not been around for that long, not very much is known about the harmful effects that they cause. But at least over 800 studies of the effects of vaping on the lungs have been done, and none of them are good. None of them have produced good results. So there have been a lot of strange deaths that the researchers and the medical people haven't known what they've been caused by. But over the last year or so, there has been an increase in cases of what is called popcorn lung, also called electronic cigarette or vaping, so called electronic cigarette or vaping product use associated with lung injury, so EVALI, and also other respiratory illnesses that have skyrocketed in people who vape. Let's just quickly talk about popcorn lung. It's not called popcorn lung because it makes lungs look like popcorn. It's called popcorn lung because it was first found in people who worked in factories where popcorn was produced, flavored popcorn was produced. And what it was is that a certain chemical that was used to provide, I think it was a caramel flavor in popcorn, that chemical was carcinogenic. So, sorry, not carcinogenic. It caused this disease, popcorn lung. And so people who worked in these factories and inhaled this particular chemical, a lot of them developed this condition known as popcorn lung. So, according to the Centers for Disease Control and Prevention, and this is a really important state, it's not a company, state, government center in the United States. And this is, in fact, something that you need to know about because you will need to know about it in grade 12, abbreviated as CDC, Centers for Disease Control and Prevention. As of February the 18th, 2020, released a statement saying that there had been 2,807 confirmed deaths of EVALI in the United States. Confirmed cases and 68 confirmed deaths as a result of this. And bearing in mind that vapes and e-cigarettes haven't been around for that long, it's obviously just going to increase. So popcorn lung is an extremely rare lung disease. It's difficult to say with certainty how common it is amongst people who vape, because it's very difficult to isolate vapors from other things that might have caused popcorn lung. So you can't with certainty go, this person is a vapor and therefore it's from vaping that they got popcorn lung. Maybe they were exposed to something else. But anyway, a study published in 2015 reported that more than 90% of e-cigarettes that were tested contained harmful chemicals known to cause popcorn lung. Popcorn lung, correctly referred to as bronchiolitis obliterans, is an irreversible, and that's critical, guys, disease that affects the bronchioles. It causes scarring and it causes narrowing of the bronchioles, which leads to wheezing, shortness of breath, and coughing. And you can see that in the diagrams below here. This would be a normal bronchiole within lung tissue, and this would be a bronchiole associated with popcorn lungs. And so what you can see is that the wall has thickened considerably, and so the lumen of the bronchiole is much, much smaller than it should be, which would mean that not enough air can get down to the lungs and not enough air can leave the lungs. Okay, so this was lesson 7, and you are to answer questions 1 to 7 of activity 6 on page 235, not pages, that should come off there. I'm asking you, however, it shows that question 1 is out of 3 marks. I think given the current situation in the world, I would like you to write a comprehensive answer. So one that's for at least 10 marks. So I would be looking for a paragraph, if not 2 paragraphs, for the answer to question 1. Okay, all right. And then I think that's all here. Yes, it is. Okay, keep well. You guys are now out of sync because choice 1 has had some bio lessons and choice 2 will only catch up next week, Monday. This has been sent to try teachers.